President-in-law and university leadership wanted to ensure that we had a robust and comprehensive approach to student health on campus and well-being. With that said, they tasked other university leadership, to include Chief Chris Daniel with the University Police Department, to bolster the initiatives we have and see what we can do to improve upon that response. With some research and kind of understanding what nationally is taking place and what resources are out there, we determined to initiate the T.R.A.C.E program. T.R.A.C.E stands for Telehealth Remote Access to Crisis Evaluation. And it's basically it's a hybrid counselor and tablet form of crisis intervention. The nice thing about this program is we employ counselors via the tablet. So there's no need to have in-person counselor with the officers responding. So that's more cost effective. It allows agencies that don't have a large budget, like larger agencies that can employ several counselors at all different hours of the night to ride with an officer. They're available at a certain amount of time. And when an officer responds to a welfare check, they bring the tablet, which I have here with them. And if the student wishes to engage a counselor as well as the officer during the welfare check to get a better understanding of what's taking place, they could deploy the tablet. Within a few seconds, a counselor is on the other end, and it allows them to have an interaction with a licensed clinician, as well as interaction with the officer. You know, the officers go into these situations with a certain level of training, but they're not licensed clinicians. So this gives us additional insight where, after the conversation and dialogue has taken place, our officers can engage the clinicians into what their assessment is, what they're seeing maybe that the officers didn't see. And there's a collaborative approach to what's the best course of action for the student during this time. So it was many months in planning. It was implemented the first of the year, right around January 1st. We've had approximately 30 welfare checks involving our officers year to date. We've deployed the tablet 5 times. We've been successful in the deployment with the technology and the interaction with the students. And it's not just student-based. I mean, this is really able to be utilized for any contact our officers have, whether it's an affiliate or non-affiliate outside the university, because we do have mutual aid agreements with other agencies. So this is really just a resource for the officer to feel that there's, you know, although not with them physically, there's a licensed clinician that could help guide them in providing the best level of service and support to our community and our students. So we have a great partnership and relationship with the USF Counseling Center, and we wanted to ensure that this process is full circle. So these clinicians are based out of Pinellas County. The advantage of that, they're not across the country, so they understand regionally what is taking place to our community, and they could better gauge their services to topics within our community. Upon completion of the interaction, to kind of make sure there's redundancy and full circle understanding there, they reach out to the counseling center and let them know the dialogue they had with the officers. But like I said, we have a great relationship with the counseling center and student outreach and support through the police department. But this is an outside party because, you know, everyone's overworked and overtasked, and that's the same for the counseling center and student outreach and support. So this is an outside entity that works in conjunction with them to provide an additional level of service. So we've had, like I said, we've had 5 deployments. 3 of those deployments, the student wanted to engage the counselor via the tablet. 2 declined, and it's completely their option. It's just, like I said, it allows us to have an additional layer of conversation with someone that's licensed and has an understanding of you know, clinical depression or mental health awareness. It's been successful. Just like any program, there's some bumps along the road to get understanding of how to utilize the technology the best, but so far, just in the short amount of time, it's been very successful. And I anticipate as the relationship grows and as we get more comfortable with this new initiative, it's going to be even more successful and provide the university community and the students on campus with additional resources, which was the marching orders from university leadership. So funding is coming from the police department. This is an initiative that Chief Chris Daniel wanted to take on because it was important to him as well as the officers within the agency. We pay an annual fee of just under $10,000 a year for this initiative. We did bring on USF St. Pete and Chief Hendry over there. So it is a collaborative partnership between both campuses. They also have tablets deployed and their officers utilize them as well. So it is not just a Tampa-centric initiative, it's a One USF initiative to provide these resources. So in the state of Florida, as far as I'm aware, this is a one of a kind for a university environment to deploy the tablet here. There are numerous agencies in Pinellas and Hillsborough County, to include Temple Terrace, that have also partnered with Directions for Living, which is the organization that has the clinicians. But as far as university setting, as far as I know, this is a kind of a groundbreaking initiative. So as far as the initiative we created, right now they're available from 9 a.m. till midnight. We're going to do an assessment in 90 days to see if there's a need to extend those hours based on call volume and welfare checks. But the university already has existing resources in place, 24/7 on-call support through the counseling center if a student is in some kind of mental crisis.